manage.
Okay. I think people will join.
Yes, they are. Okay. Namaskar, good evening. Welcome once again to Wellness Chopal, our session number 322, which we are carrying on since 2019. It is with your love and affection and your interest in looking after yourself that we have been able to carry on this Chopal for all these years. Well, so to share with you, we are in session number 322. I welcome all participants from various organizations and supportive organizations also. And as usual, हम हर फ्राइडे अपने आप से एक वादा करते हैं, प्रण लेते हैं कि हम अपने स्वास्थ्य की जिम्मेवारी खुद लेंगे. सो मेरे को बड़ी खुशी होती है आप जब सब मेरे साथ इस प्रण में हिस्सेदार बनते हैं. And believe me, it is one of the most motivating times that we have this session, where all of you agree that you are responsible for your health. So join me in saying, in taking our Friday evening pledge, please unmute yourself ताकि खूब शोर मचे और प्रोफेसर हर्षवर्धन को हमारा शोर सुनाई दे. So please join me in saying, मेरा स्वास्थ्य मेरे हाथ,
मेरा स्वास्थ्य
मेरे हाथ.
मेरा स्वास्थ्य
Very nice.
मेरा स्वास्थ्य मेरे हाथ मेरा स्वास्थ्य मेरे हाथ मेरा स्वास्थ्य मेरे हाथ
बहुत बढ़िया, बहुत ही बढ़िया, बहुत ही बढ़िया. This is the आवाज which I love. So today we have one of the country's most distinguished cardiologists, Professor Harshvardhan, who was the head of department of cardiology at the RML hospital and has been the leading cardiologist in RML hospital, and presently is a consultant at the Supreme Hospital in Surajkund. Our topic today is variations in blood pressure in elders. ब्लड प्रेशर का इलाज तो हो ही रहा है, लेकिन आप कईयों में से आपने देखा होगा कि कुछ दिनों से कुछ बदलाव हो रहा है बीपी का. So I think before we invite Professor Harshvardhan, I'll request Pragati to please give up a small few questions, just 3. Are you taking medicine for high blood pressure? Just yes and no. Are you taking, आप अगर blood pressure की दवाई ले रहे हैं कि नहीं ले रहे? That is a simple poll question. You can just click on the yes. I think the Zoom is creating a problem today.
Sir, are you able to see the poll?
Yes, I'm able to see the poll, but people, I don't know whether are able to see. Are you, are you ready to, are you?
Yes, sir. Yes, sir.
yes we can
Yes, we got it. We got it.
Okay.
Sir,
We
I will
replied.
try to show you.
Hold for it.
Okay. So out of the 66 people are saying that they are taking medicine. Okay, next question, please. Are you noticing a change in your blood pressure reading recently? 2-3 हफ्तों से क्या आपने नोटिस किया है कि आपका ब्लड प्रेशर रीडिंग बदल रहा है जो नॉर्मली स्टेबल रहता था? Right. So another 5 seconds and we will turn to the last question. Okay. Third question, please. Third question. ओके जब कभी आपने नोटिस किया कि आपका ब्लड प्रेशर अप डाउन हुआ, क्या आप दवाई खुद बदलते हैं या डॉक्टर से सलाह लेके बदलते हैं? So very nice, very good patients, very careful people they are all, that they always consult their doctor. So Dr. Harshvardhan can get an idea कि ये कितने केयरफुल लोग हैं या केयरलेस लोग हैं। और सेल्फ मेडिकेशन एल्डर्स में बहुत होता है। आई होप आप सब लोग सच बोल रहे हैं। 83% have said they always go to a doctor. ये मेरे को डाउट लग रहा है, वो या तो बहन जी को फोन करते हैं या मामा जी को फोन करते हैं, बताना वो वाली दवाई कौन सी है। एनीवे लेट्स एंड द पोल। थैंक यू प्रगति।
सर ये आपका अटेंड करने का इफेक्ट है। यू हैव ऑलवेज सेइंग कि कोई भी प्रॉब्लम हो डॉक्टर कंसल्ट करो, सो
थैंक यू मैम।
नंबर इज
Good. I'm so glad. Okay, Pragati, we can do away with this. So let's get Professor Harshvardhan on the pin. So Dr. Harshvardhan, आपने देखा कि a large number of people here are taking medicine for high blood pressure. Not many have noticed change, but it has been seen कि blood pressure constant नहीं रहता. So we would invite you to please give your broad outlook, blood pressure एल्डर्स में, यंगस्टर्स में क्या फर्क होता है, क्यों तंग होते हैं, एंड देन वी विल कम टू, आई एम श्योर लोगों के बहुत सारे सवाल होंगे, so we will come to the question answer. Welcome, Professor Harshvardhan. Thank you for joining.
Dr. GREWAL, first of all, I must compliment you for having organized these sessions for last 3 years, which I'm sure has been very helpful for all the participants. And I think your pledge, Mera Swasthya Mere Haath, is very apt for hypertension, because for hypertension is totally in our apne haath, because this is such a disease that it doesn't cause any symptoms at all. And it's up to us to control it or not control. If you see most of the people, they don't give importance to this disease, saying that there are no symptoms, why take medicines? And they don't understand the long-term harm they are doing to themselves. I think if they control their blood pressure properly, I think half the battle of health is won.
Oh.
Because if you see, hypertension is the most important risk responsible for the global deaths. And I'm interested to see your voting pattern. 66 people said that they are suffering from high blood pressure.
Yes.
Medicine, and this is out of how many?
Out of 60 people.
So you can say almost 90% of the people in this age group are suffering from high blood pressure.
Yeah.
And as the age advances, definitely the prevalence of high blood pressure increases. Whereas in the younger population, it may be about 25% of the population which suffers from high blood pressure. But if you see above the age of 60, almost 90% of the people suffer from high blood pressure. And it becomes even more challenging in the elderly people to control the blood pressure. I think I don't have to elaborate what is systolic blood pressure, what is diastolic blood pressure, and what else. Pulse pressure, because most of the people who are in the audience know what all these readings are. But still, for the sake of brevity, I'll say that whenever you measure a blood pressure, the upper reading that you get is known as a systolic blood pressure. The lower reading that you see is the diastolic blood pressure. And the difference between the two is known as a pulse pressure. Actually, this is the pressure which is present inside our blood vessels when the heart contracts and relaxes. When the heart contracts, it is known as systole. And the pressure that the artery has to face is the systolic blood pressure during contraction of the heart. And during the relaxation phase of the heart, the pressure that is on the arterial wall is the diastolic blood pressure. So, having said that, the the difference, I think, between significance of systolic and blood pressure and diastolic blood pressure is important in relation to the age. Whereas in younger people, we see that it is the diastolic blood pressure which is usually important for the long-term prognosis. In the elderly people, it is the systolic blood pressure or the upper blood pressure that is important to determine their long-term prognosis. Why does it happen? Because as we age, the our blood vessels, which are very elastic in young age, they become rigid. You see, these arterial wall are almost like shock absorbers. When the heart contracts, a lot of blood is pushed into it. The great blood vessels dilate and they accommodate that blood so that that very high blood pressure is not transmitted to the peripheral arteries. But as the age advances, these pipes become rigid, like, and they lose their elasticity, with the result that they are not able to absorb that shock of the sudden output of blood volume from the heart. जैसे गाड़ी के शॉक एब्जॉर्बर खराब हो जाते हैं, ऐसे एज के साथ आर्टरीज की इलास्टिसिटी कम हो जाती है, with the result that the arteries have to face a higher systolic blood pressure. And with the increasing age, the systolic blood pressure increases and the diastolic blood pressure decreases. Whereas the systolic blood pressure is very important for sending blood to all the arteries, all the organs of the body. For circulation of the heart, it is the diastole which is very important, because the filling of the blood vessels of heart, that is the coronary artery, that occurs during diastole. So if the diastole blood pressure becomes less of the blood goes into the heart muscle. So I think these are few things that we have to understand in relation to the age and blood pressure. Number one, with the age, the systolic blood pressure becomes high and the diastolic blood pressure becomes low because the elasticity of the blood pressure is reduced. Whereas damage to most of the organs depends upon the systolic blood pressure. The circulation of the heart depends upon diastole, and if the diastolic blood pressure becomes low, the circulation to heart gets reduced. So, what is this variability of blood pressure? That is the center of our today's discussion. We know that our blood pressure, we say normal is 120 by 80, though it's not a constant figure. Any blood pressure that is systolic, that is above the 140, and diastolic, that is above 90, we consider it as hypertension. But this blood pressure doesn't remain constant. It is not, you will see many times patient that they say, डॉक्टर साहब मेरी मशीन ही खराब है, एक बार देखो तो ब्लड प्रेशर 140/90 बताती है, थोड़ी बार देखो 150/85 बताती है, और थोड़ी देर बाद देखो तो 145/85 बता देती है. It is not the machine that is defective. It is the normal physiology of our body that our BP keeps on varying every minute to minute. And that variation depends upon many factors, like what is our mental status and how much physically stressed we are, what physical activity we have done, whether we have taken recently tea or coffee, whether our bladder is empty or not. So this is one thing, that blood pressure keeps on varying from minute to minute. But if these variations become too much, then they become pathological and harmful. And we have to see what are the normal variations in the blood pressure. One I said is the diurnal variation. That is the blood pressure varies with the time of the day. Our blood pressure is maximum during the early hours of the day. When we get up and up to say 9 o'clock or so, the blood pressure is high. Then it becomes slightly low till 1 o'clock or so, and then again it starts rising. And it dips at the night. So in a normal healthy person, the blood pressure will be high during the early hours of the day and least when we are sleeping. That is the nocturnal blood pressure, that is lower than the daytime blood pressure by at least 10 to 20%. So even if that doesn't become low, that is also a problem. That is also a disease of the some organ of the body. Another cause of variability of blood pressure is the temperature, the seasons. we have always seen those who are taking medicine that whenever the winter sets in, our requirement for medicines increases. We have to take more medicines, take better, we have to measure our blood pressures more frequently. And also the blood pressure also doesn't get controlled so well. So temperature plays a very important role in that. Then is the emotional stress. So we have to understand all these factors, that what is changing our blood pressure or not. So I think if we have to understand this, we have to really see that our blood pressure is measured properly all the time. And I think that is the most common cause of variability of blood pressure: improper measurement or inaccurate measurements of the blood pressure. So I think I like to spend 1 or 2 minutes to tell you how it should be taken, the blood pressure should be taken. Because many times I keep on receiving phone calls from the patients, Doctor Saab, my blood pressure is so much and very high and all that. And when I ask them to come to my clinic, I find that their blood pressure is fine. Only thing is that they have not measured their pressure accurately, and they have come to the conclusion that their blood pressure is high. So one must understand how to measure the blood pressure accurately. When we are measuring our blood pressure, we should be taking rest for at least 5 minutes or so. We must be in a relaxed phase. We should be sitting in a chair and not just lying down or in any position. And before we get our blood pressure measured, we see to it that we have passed the urine and our urinary bladder is empty. And we have not taken any tea, coffee, etc. in last 30 minutes. So that means it has to be taken in the resting phase. Another thing that is very important in winter is that we should not measure our blood pressure over the clothes. We should remove clothes from the arm, and it should be from the bare arm that we should measure the blood pressure. So I think all these precautions have to be taken while measuring the blood pressure. Only then we know the blood pressure. And another thing, when we are monitoring our blood pressure regularly, we should monitor at the same time of the day, because I have told you that the blood pressure keeps on varying during each time of the day. Somebody may say, "Yeah, Doctor, yesterday my blood pressure was 140 by 90 and today is 150 by 100." And I think only difference is that yesterday probably he had done in the evening, today is done in the morning. So these factors must be taken into consideration while controlling our blood pressure. So blood pressure measurement is very important. I think in particularly in the senior citizens, it sometimes becomes very difficult to control the blood pressure, because we have to see that our systolic blood pressure is well controlled. And how much should be the control? Gone are the days when we used to say that for an elderly person, the normal blood pressure is 100 plus H. We no longer recognize it. The target blood pressure is same for every age, whether it is a young person or an elderly person. We should aim to achieve a blood pressure systolic 130 and diastolic 80. And we should start treatment whenever it is, we call it hypertension, although when it is 140 by 90, but our aim should be to bring it to 130 by 90. And also we should see that our diastolic blood pressure, lower blood pressure, while doing this doesn't go below 60. Because if it goes below 60, it will be counterproductive, because the circulation to the heart becomes less. And we should see to it that the diastolic blood pressure always remains above 60. I think these are the few things which I wanted to tell you about the blood pressure in the elderly, and how the blood pressure variability plays a role. And I'm sure now we can have one-to-one discussion. I can answer whatever your queries are. And that's what I think Dr. Grewal wanted, that in this subject, there may be a lot of questions and we may like to spend more time in the interaction.
That's right.
Because almost 90% of the people are suffering from this disease. They take medicines, and usually most of the people are nowadays very conscious, and they measure blood pressure very frequently, rather more frequently than it is required. And they have a lot of questions about this. high blood pressure and blood pressure variability. So I'm open to any questions, whatever you ask, and I'm sure we'll have a fruitful discussion.
थैंक यू प्रोफेसर हर्षवर्धन। बहुत ही संक्षिप्त में आपने इतना बड़ा सब्जेक्ट नैरो कर दिया और बड़ा एक डायरेक्शन दे दिया आपने। आई थिंक I'll on behalf of everybody I'll just introduce 2-3 questions, then people can ask their questions. 65-year-old person, उसको पहले कभी ब्लड प्रेशर नहीं हुआ, ब्लड प्रेशर मतलब हाई नहीं कभी रीडिंग आई। क्या एक 65 या 70-year-old पर्सन को इस उम्र में भी ब्लड प्रेशर होने के चांस है?
That is right. That's what I was telling you, Dr. GREWAL. Even with the people who have a normal blood pressure at the age of 55, when they cross the age of 60, 65, almost 90% of them will develop blood pressure. So it increases with the age. As our age advances, the blood pressure keeps on increasing. Another thing we should always have to remember when to call it a blood pressure. If a person is coming for the blood pressure reading for the first time, only on the basis of one reading, we should not label him high blood pressure. We have to properly take the blood pressure. Whenever a person comes for blood pressure, as I told you, that the person should be resting for 5 minutes, must have evacuated the bladder, should be sitting comfortably, stress-free, and we should take at least 3 readings. I always ignore the first reading, but first reading you will always find invariably a bit high because the person is settling down. And I take average of second and third reading. That usually gives you what exactly is the blood pressure. And this should be high on at least 2 visits. If it is high on 2 visits, 1 week apart, then I will label it a high blood pressure. Just a single high reading doesn't label a person high blood pressure. So if a person is coming for the first time, it is entirely a different thing. We have to label him whether he's suffering from high blood pressure or not. And if we have to label him high blood pressure, we have to see that it is high on at least 2 separate sitting and it has been taken properly with 3 readings taken at each visit.
Dr. Harshvardhan, these days there is a lot of discussion about ambulatory blood pressure monitoring. They are advising people that आप ये blood pressure रात को ये मशीन लगती है, सारी रात बीपी रीडिंग लेते हैं और सुबह उसकी assessment होती है. How important it is to have ambulatory blood pressure reading and what it is to diagnose somebody as having high blood pressure?
I think, Dr. GREWAL, this is a very important question. In fact, I wanted to discuss about it because it doesn't come in this. It's very good that you have asked it. You see, there are some terms like a white coat hypertension, and there's another term like a masked hypertension. White coat hypertension, that a person is not suffering from the high blood pressure, but the moment he sees a doctor, his blood pressure shoots up, and when the doctor measures the blood pressure, it is high. And the person says that when I am at home, my blood pressure is usually normal. But whenever I come to your clinic, my blood pressure is always high. And this is quite common. People have stress of going to the doctor and getting blood pressure. It is just like exam जाने से पहले हमें anxiety ज़्यादा होती है और उससे तुम्हारा blood pressure बढ़ जाता है. It is just like that. When they go to doctor, many times their blood pressure, this is known as a white coat hypertension. If we really want to diagnose whether such a person is suffering from high blood pressure or not, we have to do 24-hour blood pressure monitoring. This is a machine which is put on the person, which keeps on measuring blood pressure every 20 minutes to half an hour during the day and the night. And this gives you an average of 24-hour blood pressure monitoring. And the 24 average should not be more than 135 by 85, or some say even 130 by 80 millimeters of mercury. The average of 24. And at night, this should be at least 10 to 20% less than during the daytime. Another type of hypertension is masked hypertension. Masked hypertension is when the person comes to the doctor, his blood pressure is high. But when the person remains otherwise at home, his blood pressure is high, but in the clinic, it is normal.
Oh.
And then another is nocturnal dippers. That is very important. If the blood pressure doesn't dip at night by 10 to 20%, that itself is very harmful. And that may signify some diseases. So we have to always catch up the night dippers. Those who are not night dippers, they need closer observation. And this can be done only by ambulatory blood pressure monitoring.
ये जो ambulatory blood pressure recording है ये घर पे ही होती है?
Yeah, this has to be done when the person is doing normal activity. You see, if the person is resting in a hospital and you are measuring blood pressure, that doesn't give you the true picture. So ambulatory means patient is walking about and doing the normal activities that he normally or she normally does. And during those activities, you continue to measure the blood pressure. It's like Holter we do for the heartbeat. This is a blood pressure that you measure every half an hour for a person to see what is the average blood pressure during the 24 hours.
In an elderly who is on medication or may not be on medication, do you recommend ambulatory blood pressure as a routine to find out the variability of blood pressure?
I don't think it is required as a routine.
Not as a routine.
Because it is, there are debates about its accuracy also being, because when it inflates at night, usually it wakes up the person many times.
Right.
And it may not give the true picture. But yes, there are certain conditions when it should definitely be done.
Okay.
Particularly when you are finding that there's a discrepancy in the blood pressures between home blood pressure monitoring and in the clinic blood pressure monitoring. Then you see there is a lot of variability during the daytime and the evening time blood pressure monitoring. Then if a person is suffering from some diseases which blunt the nocturnal dipping, particularly if a person is suffering from the kidney disease, if a person is diabetic, if a person is having orthostatic hypotension. Orthostatic hypotension is another type of pathological variability, I'll say. What happens is when in certain diseases like Parkinsonism, diabetes, our autonomic nervous system becomes defective. Then one develops orthostatic hypotension. Orthostatic hypertension, I have to tell you in simple terms, is that whenever we are lying down and we suddenly get up, or whenever we are sitting up, when we suddenly get up, our blood pressure becomes low. But if our reflexes are okay, this blood pressure returns to normal within 2 to 3 minutes. Because the nervous system takes over, the sensors of the nervous system, with the result that the muscle tone increases, the arterial tone increases, and the blood pressure comes back to normal. But if this autonomic nervous system becomes defective, which may be because of disease like Parkinsonism, diabetes, or very elderly age, a person is frail, then these people can have orthostatic hypotension. And this is the most common cause of falls in the people.
In the elders.
So we have to be very careful that whenever we measure a blood pressure, we should always note down the blood pressure in sitting as well as the standing position. And we should always rule out the orthostatic hypertension, because our aim should not be only to control the blood pressure, but also to see that it is not over controlled, that it leads to orthostatic hypertension and a person falls down. So in a elderly people, it becomes rather very important that the blood pressure is controlled by doctors, monitored by doctors, to see that there is no orthostatic hypertension, and also that the medicines, their BP variability is not so much. And also we should measure blood pressure in both the sides, left arm as well as right. Normally the variation in the blood pressure between the two limbs should not be more than 10.
Not more than 10.
Yes. If it is more than 10 on repeated reading, it means there is a blockage in some of the arteries. And they need a more workup to see that there are no blockages in the other blood vessels, say the arteries of the brain, the arteries of the heart, etc. Because that points that a person is suffering from atherosclerotic disease, and the atherosclerosis in other arteries should also be ruled out.
So I think ये जो आपने orthostatic blood pressure बताया, which is के लेटने पे और खड़े होने में blood pressure की difference है. In the elderly, who quite a few elders have sarcopenia, means muscle mass कम हो जाता है.
That's right.
What do you think? Muscle mass reducing also changes the response to correct the blood pressure?
Yes, that's right. Because whenever we stand up suddenly, as I said, the frail people, the elderly people, their calf muscles are not so strong.
Not so strong.
With the result that they are not able to bring back the blood pressures immediately while standing. With the result that the circulation to brain becomes less. Gravity plays part. The blood pressure, the blood volume gets pulled in the legs and the lower part of the body. Brain receives less circulation. The blood pressure in the upper limbs and the brain falls, and that's why they get fainting attacks and suddenly standing. So one should always give these instructions to the elderly that they should always keep them well hydrated, because if one is not properly hydrated, then again the chances of this orthostatic hypotension increase. Then
Before I open one last question, Professor Ashwardhan, the complications of blood pressure, जो complications है, whether they are in the eyes, in the heart, or the kidney, is there any cut-off point in elders के जी 150-90 से ऊपर आपको complication आएगा, 140-90 पे आपको complication नहीं आएगा, ऐसा कोई cut-off है या at any point the elders are at risk to get organ damage?
I think one has to understand that there is no sacrosanct finger that below this blood pressure you are safe and above this blood pressure you are unsafe. It doesn't mean that if we say blood pressure 140/90, it doesn't mean that the person at 141 blood pressure is more at risk and 139 is has no risk. It is a continuum. Only thing is just to give a figure, yes, at this level we should treat. We should treat with medication. That these figure has been set in. But it is always better. 130 blood pressure is always better than 140. The long-term survival and benefits will be better in a person who has got a 130 blood pressure. And it will be still better if the blood pressure is 120. There are trials which have shown that you should rather try to become blood pressure to 120 or 115.
Even in the elderly?
Even in the elderly. But only thing is that requires close monitoring, as I've told you, proper monitoring of the blood pressure, and make sure that there's no orthostatic hypotension in these people.
So I think before I hand over the openings, variations of blood pressure जो हम आज बात कर रहे हैं, variations के triggers जो आपने बताए, most important variation. One is normal. Variation normal माना जाता है. Second is that is there any difference in blood pressure variability with meals? लोग अक्सर कहते हैं मैंने खाना खाया इसलिए हाई हो गया, मैंने आज मिर्चें खा ली इसलिए ज्यादा हो गया. Are there any food items that raise blood pressures?
I don't think it is any food item as such. Anything, of course, which have more caffeine in it will increase the blood pressure. That's why we say that blood pressure should never be taken after you have taken caffeinated drinks, tea, coffee, alcohol, cold drinks.
Cold drinks.
They will definitely increase the blood pressure.
It's a pleasure. Right. Before there is a question in the chat box. First of all, it's a pleasure to have Dr. Umesh Valecha with us today.
Yes, I can see him.
Yes, very good pleasure. Thank you, Valecha, for joining. Somebody has asked a question. What should be the time gap between two successive readings? आपने कहा था दो पहली रीडिंग छोड़ के दो.
Yes, first reading should be after 5 minutes of resting, and then the reading should be in the gap of 1 to 2 minutes.
1 to 2 minutes. Not half an hour.
No, within 1 to 2 minutes. These three readings should be within 1 to 2 minutes. The first reading should be 5 minutes after resting.
I'll now open the questions to anybody who wants to. Please, you may just raise your hand and let me know. Yes, Mr. Makin, please go ahead. We also welcome Nisha Uri. It's a pleasure, Nisha, to have you over. I think all of you I must tell you with great pleasure that Dr. Nisha Uri, Umesh Valecha, Professor Harshvardhan, and myself are classmates. So there is much more pleasure to see all my classmates here. It's a great pleasure. Yes.
Doctor sir, good evening.
Good evening.
I have a very different point of view, little different in the sense I'm a heart patient.
Okay.
I'm on a lot of medications, as you know that. With these medications, my blood pressure remains in the range of 100 to 115 by 70, 75, in that range. It doesn't go beyond this.
Your voice
So will
is.
it be taken as a normal? Or
Can you say again? Your voice is breaking.
sorry.
थोड़ा
Okay.
crack हो रहा है.
Hello.
Yeah.
Is it better now?
And
Okay. Doctor, what I was trying to say is I'm a heart patient basically.
okay.
Gone through bypass and a CRTD implant. And I'm in regular medications, various medications, as you know, on that. With all this, my blood pressure remains in the range of 100 to 115 by 70, 75. Will that be taken as normal or low?
You see, this blood pressure will be taken as normal.
Okay.
100, 110 is in fact a very good blood pressure, and 70 diastolic blood pressure is a good pressure. Only thing is your
Okay.
diastolic
Thank
blood
you.
pressure should not be less than 60. That you should always be careful. Another thing,
Sorry.
blood
Your
pressure,
voice got.
your blood pre- is my voice breaking?
ठीक है.
No, it's breaking now.
Okay, let me go to the other room. Just wait for a minute.
Sorry.
Mr. Lekhraj Chok's question is a
You see, as I told you, can you hear me now?
Yes,
Yes.
now better, much better. Yeah.
As I told you earlier, that
Mhm.
the systolic blood pressure 110, 120 is normal. One should rather try to achieve this systolic blood pressure. And
Okay,
that
very good.
should also be less than 90 always, preferably less than 80, but never below 60. Since your blood pressure is 70, it is absolutely fine.
Okay.
Because the filling of blood vessels to the heart, that occurs, depends upon the lower blood pressure. Whereas filling
Okay.
of every other organ depends upon the upper blood pressure.
Yeah.
Our heart muscle receives blood pressure when heart is relaxing and
Yes.
artery gets filled up at that time. So
One more.
that in an order to reduce systolic blood pressure, we should not reduce the diastolic blood pressure too much.
Too much.
Okay. So one more point.
Yes.
Sometimes we get a pain into the arm as such. At times it becomes for a day, for 2-3 days or whatever. Not over a short time, maybe 1 hour for half. Is this related to the blood pressure?
No, I didn't get
Is
you.
this pain in the arms or shoulder?
No,
Sometimes we do get pains in the arm.
No, pain in the arm is never because of the blood pressure.
Never.
Okay.
Most of the times, the blood pressure doesn't cause any symptoms. That's why it's called a silent killer.
Okay. Thank you.
And if anybody has high blood pressure, Professor Harshvardhan,
Yeah.
if he has a problem, it means it is a complication of blood pressure.
That's what I was coming to. Many times what happens is, this is a very common thing. We receive phone call, डॉक्टर साहब मेरे को रात को बड़ा सिर दर्द हो रहा था, मैंने ब्लड प्रेशर लिया तो मेरे 150/90 था, 160/90 था, मैंने एकदम ब्लड प्रेशर की दवाई ले ली. This is wrong, because in fact BP was high at that time because of your headache, and the cause of your headache needs to be seen. You see, it's a common tendency to measure blood pressure only when we have some symptoms.
Yeah.
Whereas it should be the other way around. Mr. Lekhraj Chokji asked
you.
a question which is very common. How long should a patient be required to take medicine once BP is normal? Here comes the bombshell. मेरा blood pressure normal आ गया, अब मैं दवाई बंद कर दूं.
Dr. GREWAL, I tell a very simple answer to this. You know, if your vision is not right, you wear specs, and the moment you remove specs, you can't see properly, you immediately put it on. It is just like that only. The moment you will stop the medicine, it will start rising again. And in fact, it will rise more than before. There will be profound hypertension. Not only that, we have to continue to take medicine, but we should make it a point to take it very regularly, because if we miss doses, the blood pressure reading may be higher than it was before.
So Lekhraj ji and all of you, please. ये बहुत कॉमन होता है जी. अब तो 130-80 आ गया, अब मैंने बीपी दवाई बंद कर दी. गोयल साहब पूछिए. गोयल साहब अपना क्वेश्चन पूछिए. अनम्यूट कर लीजिए अपने आप को.
Sir, role of
Doctor,
मेरा सवाल ये है, आपने बहुत अच्छा बता दिया कि मेजरमेंट करना है, कैसे करना है, कितना फ्रीक्वेंसी पे करना है, कब बीपी होगा, लेकिन मेरा कहना है ये कि जिसको हाइपरलिपिडियम है या डायबिटीज या और किडनी प्रॉब्लम नहीं है, हाउ दे शुड कंट्रोल बिसाइड्स मेडिसिन? डू यू सजेस्ट लाइफ स्टाइल चेंज तो है, बट वट एवर सजेस्ट?
डॉक्टर हर्षवर्धन आप म्यूट हो गए.
You see, whenever we diagnose a high blood pressure, it depends how much is the high blood pressure. We stage it stage 1, 2, 3. I need not go into detail. But if it is mildly raised, it is always essential that first we try all the lifestyle measurements, which means a regular walk, less of salt in the diet, and we can take slightly more of potassium. Try to reduce weight, take less of saturated fats. And if even in spite of all these lifestyle modifications that we do, if the blood pressure remains high, we have to take the
तो
drug.
ये कब तक वेट करें? 6 महीने, 1 साल?
6 महीने, 1 साल नहीं, 1-2 महीने आप ज्यादा से ज्यादा. So if it doesn't work, you have to go to medical.
I think
Also, if it is
one should stop smoking also if you're doing.
absolutely.
Absolutely.
Another thing is, whenever we are treating high blood pressure, we have to see that we are not only to treat high blood pressure. High blood pressure is only one of the risk factors for heart disease. Our aim is to reduce the heart disease. So we have to take care of all the other risk factors that are present in the body. Today we discussed about high blood pressure, but high blood pressure is only one part of the picture. We have to see that our blood sugar is controlled. We have to see that our cholesterol levels are all right. They are not high. We are not to smoke, have a regular activity, take our weight under check, that we remain ideal body weight. And also in our diet, we avoid saturated fats and high salt items. Particularly, I'll say all the stored items, all the stored foods we should not take.
Not take.
Because the preservative used in all stored food is either a salt or an oil. Without that, you can't preserve any
Can't
food.
preserve food.
So don't take any packed foods.
No, but don't take at all, और उसका कभी-कभी तो इस्तेमाल कर
Don't
सकते हैं.
take at all.
Oh my God, बड़ा मुश्किल है.
नहीं, आप फ्रेश वेजिटेबल्स लीजिए, फ्रेश फ्रूट्स लीजिए.
कभी तो स्वाद आने दो यार.
नहीं कभी
अचार कम से खाइए.
एक Dr. S.K. Pal is asking, antihypertensive medicine is better taken in morning or night?
You see, there also the opinion is divided. I think it's best to take. It is now recommended that you should take in the morning. But again, if your ambulatory blood pressure is showing that your blood pressure doesn't fall during night time, as I said, on ambulatory blood pressure, normally the blood pressure tends to fall by 10 to 20%. But there are certain diseases when it doesn't fall, particularly if associated kidney disease, diabetes, etc. Rather, the nighttime blood pressure may be slightly higher, which is we call it reverse dipping. In those people, we have to give antihypertensive medicines at night. If a person is not suffering from these comorbidities, I think it's okay to take blood pressure medicines during the morning hours.
Rashmi Bhargav ji, please go ahead with your question. After that, Dr. Sahi.
Another thing I like to say, GREWAL, that previously we used to have this debate because most of the medicines that we used to give had a short duration of action. And we know that the blood pressure is highest during the early hours of the day. But nowadays, most of the medicine that we give have a 24-hour duration of action.
So it doesn't make a difference.
It doesn't make too much of a difference.
जी रश्मि जी,
डॉक्टर साहब मुझे ये कहना था कि जैसे पहले एपीसी एक मेडिसिन होती थी, तो हम उसको एपीसी को कहते थे अचार पापड़ चटनी. वी शुड नॉट टेक दिस इन द बीपी.
नहीं लेना, इसमें साल्ट और ऑयल के अलावा कुछ नहीं
लेना. अचार पापड़ चटनी, एपीसी इज नॉट शुड बी टेकन.
एब्सोल्युटली
राइट जी, राइट.
हम अपने हॉस्पिटल में कहा करते थे डोंट टेक एपीसी बिकॉज एपीसी मेडिसिन इज बैंड नाउ.
बट पॉइंट इसको इसके बगैर रहता नहीं है.
एपीसी हमें खाना नहीं, कोई खाता था उससे बीपी होता था. We used to say, don't take this APC, otherwise you have to go to the doctor.
बिल्कुल,
That's right. That's right.
absolutely.
Madam Suma Iyengar, please.
भैया नमस्ते।
नमस्ते।
नमस्कार। मुझे ये पूछना था कि मेरा जो बीपी है वो हमेशा कांस्टेंट एक ही समान रहता है, बड़े दिनों से है। जैसे 145 ही रहता है और नीचे जैसे 90, अंडर 90 के अंदर आता है। तो क्या मुझे जाके फिर कंसल्ट करना है डॉक्टर से कि कांस्टेंट, और कोई मुझे ऐसा वो नहीं है, मतलब इशू नहीं है?
आप
और
इतना बीपीए कांस्टेंट रहना बड़ी अच्छी बात है, बट ओनली थिंग इज मेजर ड्यूरिंग मॉर्निंग एंड इवनिंग. Does it
हाँ,
remain same at the during those hours also, which is unlikely.
Which is,
ओ,
and
तो
would such a person not benefit by ambulatory blood pressure recording?
No, I think one can measure morning and evening.
That's it.
If there are no other risk factors, there is no need for ambulatory blood pressure monitoring because it is in the normal range.
Right.
But if it was varying too much, then rather it is required ambulatory blood pressure.
Right.
अच्छा।
चुक साहब बोलिए, अनम्यूट करिए अपने आप को, अनम्यूट कर लीजिए। चुक साहब आपकी आवाज नहीं आ रही।
ये मुझे ये पूछना था कि कौन से टाइम मॉर्निंग के टाइम बेस्ट रहता है, 10 o'clock मॉर्निंग या और उससे ज्यादा, मतलब कब?
It is not the time, it is 7 o'clock, 8 o'clock or 9 o'clock, but best is to take before your first meal and before you take your medication.
मेरा
Okay.
क्वेश्चन ये था कि मैं एक मेडिसिन को बड़े लंबे टाइम
Thank
से ले
you.
रहा हूँ, क्या मुझे वो कभी चेंज करने की जरूरत है अगर मेरी बीपी कंट्रोल है और ठीक है?
I think you should get still regularly checked up and see whether it is really controlled or not. There are people who are taking same medicines for 8 years, 9 years, and they don't require any change. Aim is to control the blood pressure. If your same medicine is able to control your blood pressure, there's no need to change the medicine.
And more important, Lekra ji, get your complications checked. Kidney check कराइए, heart check कराइए, eyes check, retina check कराइए. अगर वहां कोई complication नहीं है तो वही दवाई लेते रहिए.
बिल्कुल.
तो जेनरिक मेडिसिन के बारे में कुछ बताएंगे? जेनरिक मेडिसिन रिकमेंड करते हैं आप?
बिल्कुल.
You can
No
take
problem. No problem. Only thing is, generic medicine or branded medicine, you have to see that your blood pressure is controlled. If your blood pressure is not controlled, then you can try to change the medicine and see why it is not controlled. But taking generic medicine is at the first place is no problem.
No problem. Dr. Shahi, please.
Dr. Harshvardhan, it's
जी,
real. It's real. I thoroughly enjoyed your informative talk, and I just want to share with my friends that I am your patient, and I mean you are giving me very, very, very good care. So it was real pleasure to have you on our Chapal.
Thank you.
Thank you so much.
Thank you, ma'am. Thank you, ma'am.
Pleasure to see you here.
The role of homocysteine.
Homocysteine. Dr. Harshvardhan, homocysteine.
होमोसिस्टिन का ब्लड प्रेशर में रोल नहीं है, बट इट इज अ रिस्क फैक्टर फॉर coronary heart disease. But that also a debated risk factor. Those people who have high homocysteine level are supposed to have high risk of coronary artery disease. But reducing the homocysteine by folic acid has not been shown to reduce that risk. So whether it is a surrogate marker or it is a risk factor is still not clear. So you can measure it, but I don't think still there's any guidelines to say whether homocysteine should be treated or not.
Thank you,
Right,
sir.
sir. Before we close, Mr. J.S. Marwa is here. वो शायरी में कोई blood pressure या दिल की बात जरूर कहेंगे.
दिल है तो
आपकी आवाज नहीं आ रही मारवा जी. अभी अनम्यूट नहीं हुआ आप. जी बोलिए जी. जी बोलिए.
डॉक्टर साहब नमस्कार. सर आपने जो भी बात कही थी कि शॉक अब्जॉर्बर.
जी सर.
जी
सर ये तो शॉक अब्जॉर्बर जो है सर वो तो गाड़ी में लग गए. कुछ हमारी अपनी जो गाड़ी है उसमें कौन से शॉक अब्जॉर्बर लगाए जाए जिससे ये तबीयत जो है वो जो इतना फ्लक्चुएट हो रहा है बीपी ये ठीक रहे.
सर ये शॉक अब्जॉर्बर हमें कुदरत ने दिए हैं बचपन से ही. ये खराब तब हो जाते हैं जब हम इसका ध्यान नहीं रखते.
जब उसका
तो कैसे ख्याल रखे जाए सर इसके लिए? बाकी
तो ये है कि हमें शुरू से ही बचपन से इसका अच्छा ध्यान रखना है. हम अपना लाइफस्टाइल अच्छा रखें.
सर मुझे तो आपकी बस एक बात बहुत अच्छी लगी है. आप इतने सवालों का जवाब दिया है, मगर आपकी मुस्कुराहट में कमी नहीं आई सर। आपकी मुस्कुराहट में कमी नहीं आई। मुझे तो ये लग रहा है कि बिंदास मुस्कुराओ, क्या गम है, जिंदगी में टेंशन किसको कम है, अच्छा या बुरा केवल भ्रम है, जिंदगी का नाम कभी खुशी कभी गम है।
सर आपने 2 मिनट में वो बता दे जो मैं 1 घंटे में नहीं बता सका।
थैंक यू सर, थैंक यू,
Thank you so much, Professor
Thank
Harshvardhan,
you.
for sparing your time.
थैंक यू सर, थैंक यू वेरी मच सर।
Pleasure. Most important is blood pressure is very common in elders. Please don't depend on your readings only. Try and find out from your doctor which is the correct medicine for you. हर एक की दवाई अलग अलग होती है. So before we go, let's thank Professor Harshvardhan, and I'm very glad Dr. Bulecha, Dr. Nishauri, Dr. K.K. Jain, we're all classmates. So it's a great pleasure to have my own classmates here. Thank you very much. And before we go, let us all once again say goodbye to Professor Harshvardhan by
Thank you,
taking
Dr.
up a
Jain.
slogan.
Bye-bye.
मेरा
थैंक यू सर,
स्वास्थ्य
थैंक यू।
मेरा स्वास्थ्य
मेरा स्वास्थ्य मेरे हाथ,
मेरा स्वास्थ्य
मेरा
मेरे
स्वास्थ्य
हाथ,
मेरे हाथ,
मेरा स्वास्थ्य मेरे हाथ.
मेरे
हाथ.
मेरा स्वास्थ्य
Thank
मेरे
you very
हाथ,
much. Thank
मेरा
you.
स्वास्थ्य
मेरे
मेरे
हाथ,
हाथ, मेरा स्वास्थ्य
मेरा
मेरे हाथ,
स्वास्थ्य मेरे हाथ।
मेरा
थैंक
स्वास्थ्य
यू सर,
मेरे
थैंक यू।
Thank you very much.
Thank you.
Thank you.
Thanks a lot.
Thank you, Dr. Harshvardhan.
थैंक यू,
Thank you.
थैंक यू।